Hi everybody. Today I will talk about knee pain in younger athletes, especially the athletes ranging from 12 to 16 years of age. Here I see prevalence and occurrence of this type of problems, especially in the pain below patella on the tendon of patella. Most of the time, the injury is called jumper's knee or patellar tendinopathy. These are common occurrence, especially girls athletes in this years. Um, and today I will try to explain how can you overcome this situation, because I see that coaches and physiotherapists and generally people tend to overcomplicate this situation, this pain, and they will say this is an injury. Okay, it is classified as an injury or overuse syndrome, but many times issue is not with the knee, and the solution lies somewhere else. Okay, most of the time the athlete will tend to say that he have a pain in the knee or below the knee during jumps, running, squatting. Most of the time during the session the pain will go up and will subdue after a training or a day or three days of rest. Um, if this becomes really chronic, the pain can persist all the time. Okay, so in the early stage, they will probably feel the pain in these activities. So it is important that you recognize this early on and try to manage it. Um, it is also important not to overcomplicate and not to spread fear in athlete's mind, because knee pain it's not so serious of a thing. We tend to think that if you have a knee pain and you in a while you will have some injuries like ACL rupture, so or some meniscus tear or something like that. But most of the time this comes from okay, some comes from growth, because the athletes are in this period of time are growing pretty rapidly. But this is aligned with what I observe, is that okay, one is connected with load or volume, intensity of training. This is one connected most of the time with can with poor biomechanics, which is also connected, not able to compensation effectively. Sorry for the typos or grammar stuff. I think we will understand each other pretty well. So this is always connected. Why I think that? Most of the time the knee pain can result from some ankle sprain, maybe some other injuries, or maybe ankle sprain, which goes back 1 month, 2 months, 3 months, maybe 1 year. Okay, 1 month to 1 year. Okay, and this creates in a way poor biomechanics. But as when you load the athlete, not if you don't load it too much with this kind of with running, jumping, stuff like that, they will not be loaded, and the pain will maybe not come. Okay, but because of the poor biomechanics of the ankle, if you then running is compromised, it's not so effective, I would say. and jumping and stuff like that. But when you do it in a low quantity, maybe the whole body can compensate effectively. Okay, so the knee can compensate, the quadriceps muscles can compensate, the hip muscles can compensate for poor stability of the ankle or poor biomechanics of the ankle or poor myofascial tension, or I can name the reasons all day long. But the main thing is that you recognize this. So how you can recognize? I would say that most of the time is problem then compensation is not effective, poor biomechanics and old injury. Then it comes to the load, volume, and intensity. So, in simple terms, what that means, if athletes training volume of running is, I don't know, 2 times 30 minutes per week, and this is also done in zone 2, I would say, zone 2, zone 3, something like that. Okay, so low to mid intensity run. Okay, you can also say, okay, 2 times, I don't know, 6K. It doesn't matter. And you come to the periodization when you say, okay, now we switch from both and stuff like that to the winter time, and I need to do more zone 2 training, especially maybe in November or December, when you want to put the athletes from ergs and stuff like that. Then you go up with the load volume, especially in volume, and you say, okay, from this week on, I don't know, let's say that until first of November, they didn't they this is their training volume. From now on, so from 1st to 31st of December, we will do a lot of running. Okay, and you say, okay, we will go running from 2 times a week for 6K. We will go in a span of 1 week or maybe even less, 4 times 6K or 4 times 8K. I don't know. You understand me? So you go, so the volume, weekly volume was here. And then you say, okay, now it's Monday. We start another periodization, especially if you're not mindful of going through periodization. So what you will do, I don't know, in November, December, you start to implement maybe also in October. I will not tell you what to do, but this is how I see it. Okay, so then you're in November, and then I'll say, okay, now we start to run, and here is the volume. So you go from you go, I don't know, 100% more volume on a running. Okay, and here after maybe 2 weeks of running, the athlete can start to feel the pain in the knee. Okay, this is the most common, I would say, what I see in volleyball, in football, and stuff like that. I ask them, what was your training sessions, I don't know, 1 or 2 months ago, and what are you doing now? And many times I would say that this is the problem. So volume or intensity doesn't matter. So you did the compensation is not adapted. So the compensation which was, I don't know, from ankle sprain. So if you can imagine that ankle is not moving perfectly, it's inefficient and stuff like that, and then the athlete will maybe start to compensate with the hip, okay, or with the knee, leg muscles, okay. So for 6K, the compensation was okay. No, you go to, I don't know, 18K a week, or I would say no, a week for 8K and many times more a week. So you go up in the volume. The body was not adapted to this compensation. Okay, I also believe that this athlete could maybe also with ankle sprain or poor biomechanics could run this kind of volume, but not like this, in from 1 week to another and start to run. Maybe he would create good adaptation to this compensation after, I don't know, 6 weeks, 8 weeks, and he wouldn't feel the pain. I hope this is understandable. And this is why maybe one guy who also had the ankle sprain before can sustain this kind of volume and intensity because he have another kind of adaptations already involved. Maybe he is doing more plyometrics than the other athlete. I don't know, but most of the time, go check, especially with this, with the knee pain. Go check what you were doing for the from last 6 months until the last month. Okay, check what you were doing, and try to see if there are any correlations with higher intensity, volume, stuff like that, and then you adapt the training to this. But you need to check where is the problem coming. I know this is hard because you're a coach and you don't have the knowledge, but I try to give you this knowledge to you now. So many times, like I said, the problem are originating maybe in the ankle muscles, hip, rotators, especially outside, inside, balance, outside, inside. With the ankle is the same. So inversion, eversion. So uh, um, ability to move the feet in this direction, and especially when you run, you need to like scoop it with your feet. So many times can be this, also can be the back muscle chain, back muscle chain. Especially in rowing, we tend to forget about back muscle chain, like flexors of the knee, I would say, biceps femoris group, especially all the group of the flexors of the knee, which are not particularly only flexors. They also tend to stabilize pelvis. So if I draw you a pelvis, and here's the knee, here is the ankles, the spine, they go, some fibers go over the ankle, over the knee joint. So what they will do, they will tend to stabilize the pelvis in the backwards. Okay, and if there is imbalance between here and here, you can have the pain in the knee, especially in rowing, when we tend to focus a lot on a quadriceps muscle to engage them, because we think, okay, we need to push. So these are quadriceps muscles. We train them a lot, but we forget about the balance in the back. Also, what I think correctly is, when you push, the push needs to go somewhere, and if also you need to have a correct tension between quadriceps muscle and biceps femoris muscles at the back. So if they are not strong enough to counter this push, or mitigate this push and balance this push when you're pushing the boat through the dry phase of the stroke, maybe you will overcompensate, or maybe the compensation of the pelvis, because when you push, the pelvis needs to be stable, will come from back, and then someone is crying of the back pain, especially in lower intensity tempos, like stroke rates like 20, 22, 24, when you start to produce a lot of watts, the power, and they feel a lot of pain here. So maybe you can ask yourself, do we work on this part as well? I don't know. This is not a critic. I'm just trying to lighten to see how I see the situation. So try to also work on these muscles, especially isometrics, uh, as well. High speed stuff like sprinting or jumping on the higher ground, something like that. And also we can do as normal stuff you already do, but try to focus on here, develop strength and endurance with these muscles. Endurance part is most of the time the problem. Okay, so here are some, some ideas how to tackle this problem. Okay, generally, it's not a good idea to put athlete aside. So train them. They must come to the set training session. And okay, if the pain is severe, okay, they don't do stuff with the legs or the movements which are hurting. Try to be mindful what I said now. Try to also incorporate some core stability. Go on the bike if it is not painful, and also in the bike try to tell them that they need also to engage the back chain, so they need to pull. When they push on the bike, they need, then in the next stroke phase they need to pull the pedals underneath them. So this is also very important, not just pushing the pedals. So bike pulling. Here you will never fail if you will incorporate pelvis muscles exercises. So glutes, inside rotator, outside rotators, you will never fail, because they if you, especially if you don't do it in a flexed position, you will never fail. These are the basic exercises. Okay, how do you progress? Like any other thing, you will progress. So when the pain stops, so closed kinetic exercises. So you start with squats without weight. Then you can do bike as well, like I said, erg, but all low intensity, the low weight. And from here, in the squats, you can, the imagination is your only the sky is the limit in the exercises. Whatever, when the knee is not in pain anymore, you can do whatever you want, but have in mind low intensity, low weight for first 2 weeks. Okay, so here what is important, it's not important to grow muscle, it's not important to develop something quick, blah blah blah. Here is what is important, is mindset, the morale of your athlete. So when he will see that for 2 weeks he can do squats without pain, then he will have reassurance in himself, and then you can start slowly doing weights. Okay, so I would do in third to fourth week. So here is a transition period, I don't know, 1 to 2 weeks. Third to 3 weeks, I would do low intensity in a way that it is like 4 to 8 repetitions reps with mid weight. So that would mean something in from 60 to 75 or 8, no 75% of his best weight, the high weight of scored before. I don't know if he have on squat on with, I would say, I don't know, 80 kilos, you go 60% of to 75% of 80 kilos, 4 to 8 repetitions. This is not a lot, but generally he will have the mental capacity. Okay, I can do some heavy lifting with a lot of rest. Okay, Not yet endurance. I wouldn't go for endurance like 30 seconds on, 30 seconds off, something like that. I will do just like that. He can do circuit training, but not with squats like that, you know. So squats I will do just separately. Also, that means also for jumping and stuff like that. What was hurting before, just to see that he can put the mind to do the repetition, you know. So not doing for the sake of doing it, but he is with the mind, with the trying to focus on what he is doing. Because when you will do uh, endurance work in the range of 12 to 15 repetitions for, I don't know, 6 uh, or 5 series, you know, this is especially with the circuit training, around 10 to 15 repetition, then off, and you go to the next exercise and you do, I don't know, 3 to 5 times. They don't work for the sake of doing good exercise, but just to do the exercise, you know, that just to pass the time, to develop to develop something, but they are not thinking of skill to do a good repetition of squat. I hope this is understandable. So you need to teach them to develop as well a skill to lift something and stuff like that. And after fourth week, I will do that. I would go back to the circuit training again, slowly, with low weight, and then progressively go like any other periodization. After a while, you go down. Okay, so maybe after 4 weeks, when everything is okay, you see, okay, can do uh, rec- uh, mm, a lot of volume. Then you go down for 1 week and then go up again. I will not tell you how to do it around periodization, because you are the coaches. I'm just giving you an idea, and this is open to discussion. I'm not saying that I have I'm right. Okay, this is just how I see it as a physiotherapist and rower. Okay, uh, yeah. So this is about it in a nutshell. I can talk about that for 2 more hours, but just so you know, knee pain is not a big issue if you approach it correctly and not do a fuss out of it, and not to tend to overcomplicate it. Um, this will happen a lot, but try to be mindful of whatever you're doing, and try to see how can you approach the athlete in on the individual level, and try to help them and teach them to develop especially skills, not strength, especially in this 12 to 16 years of age. You don't need to care about strength as much as the skill. Okay, so uh, try to develop skills to lift weight, how to lift weight, how to do squat. It's about the skill, like on the water. You know, the same with the boat. It's a skill to push the boat quickly throughout the water. It doesn't matter how much. Yes, it matters how strong you are. But if you're strong and you cannot feel the boat, and you are just moving mountains with the water, then you know that boat will not go fast. It's the same here. Okay, weightlifting exercises are not about always about muscle growth and endurance growth. It's about skills and body feeling, and how to incorporate these body feelings into sport we do, which is rowing. Thank you.